Advanced practice nurses encounter patients who present with many chronic conditions. In this scenario, we will explore the use of the complementary alternative medication, cranberry pills, for the prophylactic treatment of chronic UTIs. Let's see what Wendy the NP has to tell her patient about this type of treatment.
Hi, my name is Wendy. I'm the nurse practitioner here at the USF Clinic. What brings you in today?
For the last 5 years, I've had frequent urinary tract infections. I don't like taking antibiotics all the time. Is there something safe that I can take that will help prevent the reoccurrence of the urinary tract infections?
I can understand how you wouldn't want to use antibiotics all the time, especially with the prevalence of resistance to antibiotics, and I would not recommend this for you. There is an alternative treatment option called AZO cranberry pills that you can use to help prevent the reoccurrence of chronic UTIs.
What do cranberry pills do?
Cranberry pills' mechanism of action in the prophylaxis of urinary tract infections is not well known. However, it is thought that it inhibits the adherence of bacteria to the bladder wall.
Is this product safe to take all the time?
Cranberry pills appear to be safe, although excessive amounts can cause GI upset or diarrhea. Something you need to keep in mind is these pills are not used to treat a urinary tract infection. However, they are used to prevent chronic reinfections from occurring. Cranberry pills can have some interactions. Are you currently suffering from any chronic conditions, or are you taking any medications, including over-the-counter, prescribed, or herbal supplements?
No, I don't have any medical problems or conditions, and I'm not currently taking any medications.
For you, I would recommend this treatment option. However, if you were taking a blood-thinning medication, such as Coumadin, we would need to proceed with caution.
Will this type of treatment be covered by my insurance? And if not, how expensive is it?
This medication is not likely covered by your insurance. However, it is relatively inexpensive and can be purchased over the counter. Recommended dosage is 2 tablets a day with a full glass of water. The cost is as low as $15.99 for 100 tablets. Do you think you would be interested in trying this contemporary alternative medicine for the prevention of your recurrent urinary tract infections?
Yes, I am interested in this type of treatment. Do you have any information that you could provide me?
Sure, I'll give you these brochures on the cranberry pills, and I'll give you some information about recurrent chronic urinary tract infections. It'll provide some more information about things that you should and shouldn't do to prevent them from happening in the future. Contemporary alternative medicines are being accepted more and more every day amongst society for the prevention and the management of chronic illnesses. As advanced practicing nurses, we must be aware of the various interventions that our patients may be using or may question use while in the office. In the case of urinary tract infections, we are finding there is a greater resistance to antibiotics. In our patients that have chronic and recurrent UTIs, it is important that we look at other interventions in order to manage and prevent future infections from occurring, and not to add to the growing resistance. Because of their high prevalence, UTIs are a public health concern, having an estimated cost of diagnosis and treatment exceeding $25 billion over a 20-year period. That is approximately $2.47 billion in the year 2000. The use of cranberries for the treatment of urinary tract infections can be dated all the way back to the Northern American Indians. Although research today has proven that it is not effective in the treatment of urinary tract infections, there is preventative properties associated with its use for chronic and recurrent urinary tract infections. Along with the incidence of antibiotic resistance, it is important that we can educate our patients about the use of such interventions for the prevention of their urinary tract infections. Going forward, it is important that we also know what the risks and values are to recommending this treatment.